Welcome all to the MDI YouTube channel. Here we are making and bringing to you a lot of videos related to diabetes and your health. You all know that November is a month of diabetes, and all our colleagues are coming to the MDI platform to give you the best advices they can in order to help in prevention and management of type 2 diabetes. My name is Dr. Fauzia Moyeen. I'm the CEO of DWC, and this whole health series is in collaboration of MDI with DWC. The guest speaker with us today is Dr. Shahid Khan. He is a family physician in Calgary, and we are very thankful to Dr. Shahid for joining us today here. We will be discussing with Dr. Shahid the effect of diabetes on the eyes. And thank you again, Dr. Shahid, for being with us.
Very welcome, and thanks for inviting me in this forum to talk about this.
You're most welcome. So our first question to you will be that what is the effect of diabetes on the eyes of a diabetic person?
Well, I will first stress on a point. We all doctors stress on the fact that there should be a very tight blood sugar of diabetes. The reason being is that high blood sugar, if they stay for a pretty long time, they have a very deleterious effects on the eye. What happens? In the eye, there's a very delicate layer of cells we call retina, or I can give it to example of with the screen of a TV or cinema screen. So those cells get damaged, and there is a gaps appear between the cells, and there is a leakage of fluid. At the same time, is damage the blood vessels, which are very crucial for the cell well-being, because they supply the vital nutrients to the cells, so they become clogged or sometimes damaged, and then bleeding occurs, and that have effects on the eye vision.
That's very true. And eyes are so important for all of us, and especially in diabetes, we have to look after all our organs, the eyes, the kidneys, the feet, the nerves, and everything. So yes, a tight glycemic control is very much needed. So again, I will bring this point in notice that why is it so important for an annual eye screen for any type 2 or type 1 diabetic person?
Well, the reason being is this. Diabetes, I will first give you example of type 2 diabetes, we call adult onset. At the time of the diagnosis, 25% of the patient already has the bad effects on their eyes. And after 20 years, these are 60 to 70% have affected eyes with this one. So that's the reason we would like to see the patient and convince them to see the eye doctor. We usually refer them annually so that we can detect it quite early, and then we treat those. The reason is this is the most common cause of blindness in Canada and USA. So that's the reason.
Yeah, and I think you will agree to me that most of the time the family doctors get referrals from the eye specialist saying that they have done the routine eye examination and they found background diabetic retinopathy, and the person is saying they don't even have diabetes. So yeah, the diabetes can lead to all these things even before a person will know that they have diabetes. So please, if you are high risk, please get yourself screened and talk to your family physician. What do you think the studies are telling us about a good glycemic control and its effect on our eyes or on our kidneys?
Yeah, there is a very famous trial, the diabetes control and complication trial.
Yeah.
We call DCCT. They said if with the tight control of blood sugar, is a 76% chances of improvement, which are really a big amount.
Big number.
Yeah, big
It's
number
a
and huge number, and it prevents because the blindness is a preventable. So and we can prevent this blindness with a tight control of blood sugar, and there is a marked improvement according to this trial.
Yes. So if you control your sugar, what the Dr. Shahid has said that this trial has shown that there is chances of reversing the damage at some stage, but if it is too late of a stage, then we cannot reverse the damage. So it is much better to get yourself screened for diabetic retinopathy by getting your fundoscopy done. If your physician has given you, please don't ignore, because usually physicians are doing their job, and what they do is they just put it somewhere and they forget. They don't make appointments, they don't go for their fundoscopy because they're not understanding the importance of fundoscopy. So I would really like to ask you that what take home message you would stress on for the diabetic people out there in community, how they should look after their eyes and not go on the path that can lead to blindness and other problems.
Well, as I mentioned before, that this is a leading cause of blindness, especially in young people between 20 to 70, 64 years old. So people usually, if it's uncontrolled diabetes, we have the patients who are already lost their eyes in their 40s, which is very productive age.
Yes.
So I would convey my take home message like this. Number one, there should be a tight control of blood sugar, and please see your family physician on a regular basis. Secondly, because the high cholesterol also, multiply the deleterious effects on the eye. So we need a tight control of cholesterol. We need a tight control of blood pressure. And if somebody is smoking cigarette, yes, so we would like to convince them that smoking has a horrendous effect on eye vision, and we need to stop that one to prevent the blindness.
Well, thank you, Dr. Shahid. So, as we have heard earlier from other speakers, that they say that if you quit smoking, the chances of getting your nerves damaged is decreased by multifold. So, smoking is very dangerous for health. Not only it kills, but it damages and it makes the life very complicated. So, thank you again, Dr. Shahid. And we thank you, all our viewers, to be with us today, and we hope to see you again soon. Thank you so much.
Thank you so much.
Thank you.